I'm here with my pal, Dr. Ask. How are you, my dear?
I'm doing great.
Good. You look wonderful. Hey, listen, we're going to talk about something very, very serious and
Very serious.
and dear to my heart because my grandfather died from oral cancer, and John has suffered from oral cancer a couple of times, and we were just talking about he had a biopsy and it came back good.
That is fantastic.
Which your heart just
right.
skips a beat when you hear that good news.
There are 35,000 cases diagnosed every year.
That's amazing.
It's crazy. And about half of the people after 5 years are no longer with us.
Right.
So it's the death rate is incredible. So we're going to talk about oral cancer. Now, what's one of the biggest causes? Let's just talk about that. My uncle was a cancer surgeon, and he told me many years ago that he's never done a surgery for cancer on a non-smoker.
Really?
Yeah.
So smoking
is huge.
Yeah.
So what can you do instead of smoking? Well, I just wanted to demonstrate that. I wanted to fit in Amador County, and I just wanted to show you what I have there.
Your chew.
My chew, yeah. So.
Which is another big contributor of oral cancer.
Well, there's some products out there that are actually less stressful or that are less of a problem than smoking. And so, I thought I would try some out for you,
Put a little bit between your cheek and your gum.
So I did this with my staff a few years ago, and they grow. So this is actually mint, by the way. But it gives you that nice, look. So it's like it'd be cool in Amador County.
Yeah. So you don't get the hot spot like you would with tobacco or a pipe.
No. I'm kind of playing with you. This is kind of a joke, but actually, this is actually a real product. Okay, if you want to stay cool in Amador County, I want to be, fit in here.
You got to have your chew.
You got to have your chew. So this is actually mint. This is not tobacco. No tobacco in here.
Oh, so it's mint.
It's mint.
You know
it's
what?
Mint.
I have.
Did you think I was actually going to use?
Yeah. I have two son-in-laws.
Okay.
Doggone it, that chew. And it just drives me up a wall.
And this is one picture we had in our office. Here, I'll leave that there. And this is a gentleman athlete that passed away because of oral cancer, and he chewed. So you can still get cancer from chewing tobacco. Yeah. So anyway, this is mint. I wanted to make that very clear. So anyway,
it smells good.
Oh yeah, it's really strong too.
Yeah, I bet it is. Now, what can people look for, doctor? Because it's very important. I know a lot of people that get a little fever blister and go crazy,
right.
Where something minor could be cancer. Absolutely.
And so that's what we're going to talk about that. So with the dentist, see a dentist regularly is one of the most important. You can look in your mouth, and if you see anything that you're suspicious of a little white lesion or a little red lesion that's been there for more than 2 weeks.
Okay.
That's when. So you can have a flashlight, okay, But see your dentist and ask them, hey, have you done an oral cancer exam, or can you do an oral cancer exam? And so we do that every time that we see the patient, and about half of the oral cancers are on the lateral border of the tongue, or underneath your tongue. So stick your tongue out, okay? So the only way to really see well is to use a 2x2, okay? And again, the dentist, and to pull your tongue out, and we actually can look, okay?
Oh.
And so hang on, let's look at it, okay. Okay, so we look under the tongue there, okay? Stick your tongue out. I know you always want to do that with your dentist, okay? Stick your tongue out, okay? There you go, okay? And another thing we can do is if we see we suspect a lesion, okay, there's a way to check it even further without having an actual biopsy, and that you rinse your mouth out with vinegar, okay, acetic acid, and then we dye it with some really strong blue dye, and the cells are more active, and it picks up the cells pick up the dye. And so that's how we can check it in the office. And then after that, you can have a biopsy. Okay.
Now, if you have any lumps or anything right away, I wouldn't hesitate. I would just go because you just don't know. And the exam doesn't last that long. It's painless.
Yeah,
You're
absolutely.
You're in and out.
Now, what goes together with smoking? When people smoke,
they
drink. Okay, now let's talk about that. You can put medication underneath your tongue. Your tongue is very, very vascular, and it picks up. It just absorbs all kinds of things. So if people that have a heart attack or heart pain, they put they put medication on their tongue.
Right.
Okay. Well, so when you're smoking and you're drinking, okay, the poisons in the cigarette just suck right down into your body through underneath your tongue, and that's why half the cancers are underneath the tongue. And so the smoking and drinking going together is the worst possible combination, okay, that you possibly can do.
And what does everybody do?
They smoke and drink. They go together, okay.
Yeah.
And so, do you know how many chemicals there are in cigarettes?
There's hundreds.
4,000.
Yeah,
You know
there's
how many of
hundreds.
those 4,000 actually cause cancer? They're known to cause cancer.
Probably about 3,999.
Close. 50.
Oh, 50?
50.
Oh,
okay?
I was really close.
Yeah, and so what are some? There's benzene. Okay, there's formaldehyde. There's ammonia. There's acetone. There's tar. There's nicotines, and of course, nicotine is the most addictive drug there is.
Right.
Okay, and so
I'm an ex-smoker, and I can attest to that. It's difficult.
okay, so and there's help. There's help if you're a smoker. There's actually help, and we have several surveys, and people quit many times. Okay, and if you can quit many times, you can quit permanently.
Absolutely.
And you just have to be real serious about it. And there's some help. There's some drugs called Shantex, and so there's some help in our office, Duck Street Dental Group. We do help with that.
I want you to come back,
Okay.
and I want to do a second part on this because
Okay.
I think it's very, very important. Because I have to run over to Mr. Merzlach right now.
Okay.
But, Doctor, I want to thank you very, very much, my dear. And we're going to go over to Cam, and I'm going to join him in just a second.
Okay. Thank
Thank
you.
you.